Welcome to Blackwood Vascular, a YouTube channel where I educate patients in real layman's terms about normal things that a vascular surgeon sees every day. I'm hoping to just simply make things very simple for people to understand, showing you guys pictures of things that we go through every day as vascular surgeons. And if you like these videos, remember this is all medical education. There's no advice here. If you want advice, go see your own doctor. But like and subscribe and follow along if you like these videos. And if you have a question or email me at blackwoodvascular@gmail.com and I can make a video for you. And again, this is Blackwood Vascular. Everything here is educational, not advice. But this video today is to explain the difference between, is to basically explain to you how lymphedema therapy happens, and explain it in simple terms. So the most important thing to understand is that there's two things you can do. Number one, massage the leg. Number two, elevate and squeeze the leg. And then there's other things which naturally should be doing, like exercise, and then just taking care of your skin. If you do all four of those things, you actually massage your leg and squeeze the fluid up the leg, and like you're squeezing a toothpaste, starting with your foot, especially in a certain pattern. If at the lymphedema clinic, that's called manual lymphatic drainage. That makes perfect sense to me in my brain. You call it, it's manually done. You're squeezing the lymphatics, or you're draining the lymphatics and mobilizing fluid. That's how you get a big lymphedema leg smaller. Okay, once you've done that, and there have been studies that show this, you now have to couple that, you know how to add to that a compression therapy with a garment or a bandage. And that prevents the leg from, once it became smaller, becoming big again. And so that's compression therapy. And finally, you should exercise to activate the calf muscle pump, which is just the natural squeezing function of the pump of your calf. And then finally, on top of that, skincare. You want to moisturize your leg. You don't want to have an infection form. You don't want to be scratching and itching at things. And you want to make sure that your tissue is healthy. And you want to use simple things. You don't want to add all sorts of random creams and stuff that would thin or weaken the skin. So you want to use things like either water-based ointments or some sort of ointment that is not. I wouldn't add things in that have too many chemicals. Try to keep it simple. I personally prefer natural things. Like if I'm not going to use a water-based ointment, I would use something just like a petroleum jelly, just mineral oil. Simple. I think of it like this. If I would put it on my little baby when they were brand new and born, then it's okay to put on my leg when I'm 65 years old and my leg is all damaged. But if I wouldn't be willing to put it on my baby's face or skin, then I'm not putting it on my leg. And so, I guess the key difference between these two terms, CDT, Complete Decongestive Therapy, and MLD, Manual Lymphatic Drainage, is that CDT is the gold standard. It's the way how you should treat lymphedema. It doesn't just move the fluid, but it also helps control the swelling long term and protects the skin and the quality of life of the patient. MLD is a technique. CDT is a full treatment program. Think of MLD as one single tool. CDT is the entire toolbox. Thanks again. At Blackwood Vascular, we emphasize that lasting results come from combining techniques, not just relying on one alone. And in the upcoming episodes, we'll explore some of these strategies and how they integrate with other emerging devices, surgical techniques, and research that's coming out. And if you have something that you want me to present on or discuss or try to dive into for you, just write me an email at blackwoodvascular@gmail.com. Thanks. If you guys found this video helpful, you subscribe to the channel. It's a 100% free. It's all educational. It's all me, real. And for personal recommendations and actually medical care, go see your own doctor. Thank you very much, guys, and good luck on your journey.